Hello and happy Wednesday to all. My name is Kyle Sebastian and I am the Higher Education Programming Coordinator at the Jed Foundation. JED is a nonprofit that protects emotional health and prevents suicide of our nation's teens and young adults. Through our signature program, JED Campus, we partner with over 300 colleges and universities across the United States to guide them in a 4-year collaborative process of comprehensive systems, program, and policy development that builds upon existing student mental health, substance use, and suicide prevention efforts on campus. JED's comprehensive approach to mental health promotion and suicide prevention for colleges and universities is the foundation and framework surrounding the JED Campus Program. While the comprehensive approach was always designed to support all students on the college and university campus, JED built upon its approach in 2017 with the Equity in Mental Health Framework, or EMHF. Created in partnership with the Steve Fund, the EMHF provides recommendations and implementation strategies to help colleges and universities better support the mental health of students of color. Today, we will overview how JED has integrated the recommendations of the EMHF into our comprehensive approach. For this webinar, I am first joined by Dr. Sophia Pertuz, Chief Diversity and Clinical Officer at the JED Foundation. Sophia joined JED in November 2018 with over 20 years of experience in strategic planning, assessment, inclusive excellence, and critical incident management in higher education. She most recently served as Associate Vice President and Dean of Students at Hofstra University and Assistant Dean and Director for Multicultural Affairs at Fordham University. Sophia teaches as an adjunct in the Higher Education Leadership and Policy program at Hofstra and has been an invited speaker on topics in leadership, diversity, social justice, and LGBTQ advocacy at various institutions and conferences, including delivering keynotes and webinars in Spanish. Sophia dedicates volunteer time sharing knowledge and skills through mentorship and organizational activities aiming to create inclusive and caring communities. She currently serves as the co-chair of the board of directors of Erase Racism. Sophia completed a BA degree in Organizational Communication from SUNY New Paltz and her MS and PhD in Higher Education Leadership, both from Seton Hall University. I am also joined by Lee Swain, Director of Program Development at the JED Foundation. Lee spent over 15 years working in higher education and student affairs before joining JED. He has experience in residential education, LGBTQ student services, academic coaching, conduct, and crisis management. Lee earned a BS in Animal Science and Secondary Biology Education from the University of Delaware and an MA in Higher Education Administration from New York University. Prior to this year, Lee was the director of the JED Campus Program. Today, participants will learn about JED's comprehensive approach and the JED Campus Program. Participants will also learn about the Equity and Mental Health Framework and how it is being integrated into the JED Campus Program through existing objectives within the comprehensive approach and new objectives that have been created. Participants will learn about schools in the JED Campus Program who are integrating the EMHF into their mental health strategic planning efforts in alignment with the JED comprehensive approach. And participants will learn practical applications for incorporating mental health initiatives with an eye toward inclusion of diverse student populations. In today's presentation, you will hear overviews of our comprehensive approach and JED Campus, as well as the 10 recommendations of the Equity and Mental Health Framework. From there, we will discuss the EMHF recommendations which have been integrated into the strategic plans which JED campuses use to develop their mental health, substance use, and suicide prevention efforts. We will then share case studies from JED campuses and schools which were part of an EMHF pilot cohort. But before we launch into the rest of today's webinar, I'd like to share a couple of housekeeping items. If you need closed captioning services at any point during today's webinar, please use the link that was provided in the welcome message as you logged on today. This will open up a second window where you can follow a live transcription of today's webinar. Second, if you have a question for our presenters, please type it into the question box on your dashboard, which we'll answer at the end of the presentation. And you can also request a copy of today's slides by emailing me at kyle@jedfoundation.org. As a reminder, today's webinar will be recorded for future access in JED's online mental health resource center. And with all of that, I am now going to pass it off to Sophia, who is going to kick off the rest of our presentation.
Thank you, Kyle. We like to start by sharing some statistics that are very sobering and definitely guide our work. Mental health concerns are impacting our 21 million college students. And at some point, this was from the 2016 Acha survey, 3 out of 5 students felt overwhelming anxiety, 1 out of 3 felt too depressed to function, 1 out of 3 binge drank regularly, 1 out of 8 abused prescription drugs, 2.2 million had serious thoughts of suicide, 1.5 million cut or burnt themselves, 336,000 attempted suicide, and 1,400 died by suicide. By now, there are more updated statistics, which we will share in the future. But even with these statistics, we're probably not far off on how this condition is for all of our students and how much we have to work on creating systems on campuses to make sure that we're giving them support that they need to be successful. A survey we did a couple of years ago showed that students of color are especially affected by many of the ways that they navigate campuses. So we wanted to share some of these statistics from a survey that we did with 1,000 college students. According to this survey, overall college experience, the rating on overall college experience being excellent or good for students of color was definitely lower than for white students. Overall campus climate lower by at least 20%. Campus safety was a big difference there too. The campus being inclusive, definitely lower for both populations of white and students of color. But as you can see, there's definitely a significant difference. And feeling isolated on campus was more pronounced for students of color. And for this survey, students of color is defined as African American, Black, Hispanic, Latino, Asian American students. And this was all self-identified. I'm going to turn it over to my colleague Lee, who's going to share a little bit about our JED comprehensive approach, which many of you may already know about, but he can share with you who don't and put it in context for how we made changes to the approach based on the data we learned from our equity and mental health framework and the survey that we did.
Thanks, Sophia. Yes, as you can see on the screen now, this is JED's comprehensive approach to mental health promotion and suicide prevention for colleges and universities. So at JED, we take an upstream public health approach to suicide prevention. While there's many things that can be done at critical incidents, there's much more that can be done in various upstream places throughout the student experience that better support student emotional well-being and hopefully then result in less crisis situations. And when we're working with schools through the JED Campus Program that Kyle mentioned, it really is a strategic planning intervention. So you'll see that all elements of our comprehensive approach within this graphic are wrapped up within strategic planning, and fundamentally that it needs to be an institutional strategic planning effort. It can't be isolated amongst one department or the counseling center, et cetera, but really holistic effort across multiple departments on campus. And you can see starting in the top left, we're talking about developing independent living skills. How and where are those educational opportunities presented to students? Who are those opportunities reaching and who are they not? Really diving in. Are there certain students and student groups and student populations who are availing themselves of opportunities to learn those skills? And are there others that are being left out? That's certainly important to think about through a DE&I lens. As we move around the wheel, also social connectedness. How and where are students finding community on campus? How is the institution supporting finding those connections? And are there certain student groups that are potentially isolated or disconnected that may need additional support? Then we're looking at the next two kind of go together, identifying students at risk and increasing help-seeking behavior. So what is the institution doing to train faculty, staff, student peers in understanding when a student is in distress? So not necessarily just suicidal, but really like when are they experiencing stress? When do we see that moving to distress? And how can we again intervene at relatively upstream moments in that student's experience to get them the help they need? And of course, as part of that too, we need to work towards reducing stigma and shame around mental health issues or struggles in general, and really let students know that it's okay to seek help when needed. So when we're working with schools, we're really talking about how can we encourage that messaging? How can we create a culture and climate that allows people to seek help when needed? As we continue around the wheel, of course, we want to ensure high quality services, whether that be on campus or through connections to community resources. But really that is about providing students with high quality access to care and continuity of care as they transition through various stages of their life. Much of that has been preventative, right? Those first 5 domains. So the next is really what is our actual intervention should we find ourselves in crisis? Because despite our strongest efforts, we're still going to experience some crises on campus, and so it's really important that the school think about what their crisis management procedures are, how they manage it in the moment, how they debrief it, and how they manage postvention after a crisis. And finally, we do also work with schools to look at means restriction and looking across campus, doing an environmental scan to really understand where are there risks for students to commit suicide or die by suicide or access means to do so, and how we can mitigate those risks. Within the JED Campus Program, so we work with schools for a period of 4 years to look at all those domain areas. Many of you may be familiar with the JED Campus Program, so I'll make this relatively brief. But we work with schools for a period of 4 years, and we do an assessment in the beginning of that, both a program review with the interdisciplinary team that is formed on the ground of the school, and then also through direct student data collection via the Healthy Mind study out of the University of Michigan to really understand the student experience. We do that in the beginning as a framing of the needs on campus, what is being done well, and where there may be some identified gaps, and then we help the school develop a strategic plan to implement while in the program. And we do work with a number of schools, all types of schools, community colleges, 4-year schools, public, private, urban, rural. We find that the program is very adaptive to different types of schools. This is just another way of visualizing that process. So in year 1, schools participate with us in an assessment and doing the strategic planning. In year 2, schools receive ongoing support from a JED campus advisor here at JED in the implementation of that strategic plan that is developed. And schools are also invited to participate in our learning community, which consists of regular newsletters with updates about resources from JED. We have an online resource center for schools to access. We have a series of webinars around different topics related to our comprehensive approach and mental health, promising practices that we see in the field. And we also have other opportunities for dialogue amongst different schools within the program. So we have group calls about certain topics, et cetera. But the purpose of that learning community participation is really to facilitate resource sharing between the schools that are in the program. So we understand that at JED we have some level of expertise, but we also know that all of the schools we work with also have an immense knowledge base, and we want to be able to share that with all the schools in the program. In the 4th year, we do move into an evaluation and sustainability phase. So we do yet another assessment of student level outcomes through the Healthy Mind study. We review progress that the school has made against their strategic plan, and really look at that together and both, pat ourselves on the back for all the good work that has been done, but think about now, given where our students are at, what the new needs of the new population is. There's always more work to do. There's no one and done when it comes to mental health. So again, thinking about how do we sustain the work that we do, but also plan for the future. Really quick, this is our theory of change. So it's important to note that within JED Campus, we are working primarily with administrators on really thinking through systems change that can be done on campus to better support student level outcomes. So as you can see, we really have a number of specific objective areas we want schools to work in related to our comprehensive approach. We have specific actions we recommend for them. Ideally, those actions will alter the student experience on campus and thus potentially alter their attitudes and behaviors related to mental health. And ultimately, our goal is, of course, to increase positive mental health and decrease substance use and the likelihood of dying by suicide. Now I'm going to pass it back over to Sophia, who's going to talk a little bit about the Equity Mental Health Framework.
Thank you, Lee. The JED Foundation collaborated with the Steve Fund. The Steve Fund is a nonprofit dedicated to the mental health and emotional well-being of students of color. So we partnered a few years ago to develop this equity and mental health framework to offer some expert recommendations for colleges and universities to better support the mental health and emotional well-being of their students of color, knowing that the data showed us that their experiences on campus were sometimes fraught with many challenges that were identity-related, and we wanted to just think of some ways that colleges and universities could really support them. So I'm going to go over the 10 recommendations that are the main ones. There are supporting action steps and other details within the equity and mental health framework. You can go to the website equityandmentalhealth.org to download it. There's also a toolkit that we'll share a little bit more about, but there's more details within both those documents. But the Steve Fund and the JED Foundation are here to support colleges and universities, and if you have any questions or need more information about the equity and mental health framework or the toolkit, please feel free to reach out to us. So the JED perspective is that we recognize that a one-size-fits-all approach to promoting positive mental health and well-being and preventing suicide needs to be culturally sensitive, needs to be culturally relevant. And we know that there is racial trauma that will impact that well-being for students. So we want to make sure that we're raising awareness and identifying what those unique barriers are to support students of color. We're committed to help colleges and universities strategically support students of color through this framework and by integrating the recommendations throughout our JED Campus Program. And that's why we're here today to talk a little bit about how did we change some of the assessment that we give with the JED Campus Program and some other considerations within the JED Foundation organization, but also specifically JED Campus and the offerings we have for our higher education program. So these are the 10 recommendations all in one place. I'm going to go over them one by one, just in case you have not become familiar. Again, you can download it. The website is on this slide. But they are very specific to the experiences of students of color. However, I believe that if you do these recommendations and colleges take them very seriously, you can help many other marginalized identities on campus. Starting with the first one. Recommendation 1 is identify and promote the mental health and well-being of students of color as a campus-wide priority. We encourage institutions of higher learning to center student well-being. That's all students, but specifically to address who are your students on campus who are feeling not connected or not feeling like they belong. And that is definitely students of color, but I believe that other marginalized identities can also benefit from this kind of prioritization. Recommendation number 2 is engaging students to provide guidance and feedback on matters of student mental health and emotional well-being. I would make the case that just asking students in general and regularly doing focus groups and surveys, which many campuses already do through different means, but doing that would really go a long way to show students that you care about their well-being and that you would like to create better campus environment for them. So the Steve Fund and JED Foundation encourages you to reach out to us if you want to know how you can do that on a regular basis. We have many ideas around that, but definitely asking students, what do they need? What are the things that would support them best? Recommendation number 3, actively recruit, train, and retain a diverse and culturally competent faculty and professional staff. It would be really ideal if the faculty and staff population matches, or at least closely matches, the student population. And that would mean really focusing on diverse recruitment and making sure that the staff that you do have are culturally competent and able to help all students. And if that means adding additional training during faculty onboarding or during staff onboarding, we strongly recommend that there be specific information about all marginalized identities, especially students of color, and what are the unique challenges that they handle on campus. Recommendation 4, create opportunities to engage around national and international issues and events. This one is particularly important when it comes to national, political, and international news that we know may be affecting students very personally. And if their personal lives and family lives might be affected, we know that that's going to impact the way they behave in the classroom. It might impact their ability to really function regularly on a day-to-day basis. So knowing where they can go to have difficult conversations or just process some of what's happening in the news, we think that would go a long way to really protecting the well-being of students and letting them know that you care and that you know that they're dealing with things outside of the institution that might impact them on campus. Recommendation 5, create dedicated roles to support the well-being and success of students of color. This can look many different ways. We suggest support staff positions like multicultural student affairs, an academic diversity officer, someone who is skilled and has the research and expertise to understand the lives of students of color and what challenges they have, and can think of strategies to share with the campus community, but could also serve as someone that students can go to if they have questions, if they want to process things, if they go through a situation and they just want someone to run it by and at least know where to report things if they happen. One thing that I would want to say about these positions is that they really do need to, if they don't exist, create them, but if they do exist, to provide them the support, staff, and resources they need to truly take on what I believe is the emotional burden sometimes of really trying to figure out how to best support a student and be there for them physically while still maintaining programming and educating the campus community. So we definitely want that position to thrive and be there for students. So I stress being supportive of that position once you do create it, or create several positions so that there's many different touch points where students can go. Recommendation number 6 is support and promote accessible, safe communication with campus administration and an effective response system. We know that sometimes things happen on campus that are bias related or bias motivated, and whether or not it is a hate crime or doesn't rise to such, there should be a way for students to communicate to someone and officially report so that they feel that there are patterns being watched out for, or that if there's education on campus that needs to be coordinated based on any incidents that are happening, that it's being tracked in some way. So we think a well-publicized and accessible process would be really helpful to the whole campus community, but definitely to students. And we suggest things like online reporting or having an office dedicated to take reports and be able to respond or track. Recommendation number 7, offer a range of supportive programs and services in varied formats. We know that many campuses already provide a variety of culturally relevant programs and try to connect students through these programs, whether it's supporting student groups and putting on workshops and other transition programs in the middle of the summer or right before school starts that help connect students so that they can feel comfortable students of color, so that they feel comfortable once they get on campus and have familiarity with the campus and have a network of support that they can create before they start school. And even while school is happening, we recommend having mentorship programs and other connections to faculty and staff that really helps with the mental health and well-being of students of color to provide them that extra support. Recommendation number 8, help students learn about programs and services by advertising and promoting through multiple channels. We need to go where students are, and if they're online, we go there. If it's social media, we go there. But definitely making sure that students are aware and that we're creative with how we share the programs. It's great to have really great resources and great programs happening, but if students don't know about them, there's a danger they may underutilize these resources. So making sure that you're creative with getting the word out is really important. Recommendation number 9, identify and utilize culturally relevant and promising programs and practices and collect data on effectiveness. We like to use the word promising practices as opposed to best, because promising could be best practice could be best on one campus, but maybe not another. But as Lee shared before, with our learning community and making sure that schools are sharing with each other things that they're doing, we believe it's really important that national surveys of programs are done, that if one campus is doing something really well, that they have evaluation data that shows its effectiveness and whether or not it is connecting students better, helping with retention, helping with graduation. But we know that there are many well-tested programs that are out there and have been for quite a while, so we believe that just looking out for that and looking at some national organizations that track information like that would be really helpful. And some of this information and which organizations are in our toolkit and in the Equity and Mental Health Framework. And finally, recommendation number 10 is participate in resource and information sharing within and between schools. Many schools do this already through going to conferences and presenting on some of the really great exemplary programs that they are very proud of. But we think finding schools that are either similar to yours or even different that are doing some really great things for students would be ideal to create as many possible variety of resources for students of color as possible. We do have a cohort that we are piloting the implementation of the Equity and Mental Health Framework. We're partnering again with the STEVE Fund to have 17 schools who have collected some data. We started in the fall of 2018. We did focus groups with students, administrators, and faculty. We also had them fill out an assessment to just think about those 10 recommendations and how they answer the questions of, for example, creating a dedicated staff member or creating a response system. And we then analyze that data to provide a report to give them some ideas on things that they can do next. What are those recommendations that are really salient for them on their campus and action steps that they can take to improve the campus environment for students of color. And then now what we're doing is we're meeting with the schools, providing them technical assistance, workshops through the STEVE Fund in topics such as microaggressions and unconscious bias on campus, how faculty and staff can better support students, how students can connect with each other. So these workshops have been happening since the fall. Some are happening this spring. The cohort of schools has been meeting with me and our representative from the STEVE Fund, Dr. Jan Collins-Eaglin, to just discuss ways to improve the campus environment and think about these 10 recommendations. And then moving forward, we're going to be ending this next year looking back at the data and figuring out what are the top things that schools really struggled with, what are the things that were pretty easy to implement. And we've got some, at the end, we'll share just a few of our 3 exemplary schools that we feel have taken some steps to really improve campus environments for the students of color on their campuses. So this is an introduction to how our domains, these are some of the domains that are under the JED Campus Program, and what are some considerations for diverse students. For example, with promoting social connectiveness, what are some things that might be a barrier to that connectedness? Sometimes campus climates are not as welcoming as places would like it to be. So that isolation due to marginalization might be another factor that does factor into how they feel connected or not to other students and to the campus community. Developing life skills. We know that resilience is something that many campuses are talking about and how to build resilience in their students, but if students are experiencing microaggressions on a day-to-day basis and really can't function because they're distracted by them and feel impacted, it's really difficult to really build those life skills. They might also have unique life circumstances as a person who feels marginalized or is on a campus. So that also might impact their ability to develop life skills. When it comes to increasing help-seeking behavior, we know that recommendation number 3, increasing your staff, your diverse staff, and also making sure that they're culturally competent. Sometimes there are cultural or religious stigma for students, and that's part of why they may not seek help or may not go to the counseling center, or they may not go to staff members who they don't believe are going to help them, or they just are afraid. They're not sure if they should speak up and share their personal troubles. Also, access to healthcare coverage. We know that that's an issue nationwide, and many students don't have access to really good health coverage that can get them mental health support the way that they need it. I think that's an issue for all students, but it's definitely exacerbated by some communities of color. The other domains that I think are definitely impacted, and we want to talk about considerations there, is identifying students at risk. Sometimes signs of distress may show up in different ways. Somebody who is a student of color may not present depression in the same way as white students might. So there are some things there that can be learned on a campus, and training could be provided to not only mental health practitioners, but also to all staff on what are the things to look for. Providing mental health and substance services is related to the help seeking. That lack of representation might limit whether or not someone might go to the counseling center again. So making sure that even if you don't have or can't at the moment hire a diverse staff in your counseling center, you can also do training and provide culturally responsive and relevant training to your staff. And finally, the following crisis management procedures. One issue here that I think might come up is mistrust of systems. We know that we're watching things in the news, and students of color are sometimes looking at authority in a very different way, and there may be perceptions that there are unequal treatment, whether it's factual or not. There's a perception that they're being targeted, or that they feel they're not going to be fully believed or honored when they do come forward with an issue and they are in crisis. So it might show up very differently. So we think faculty and staff can definitely benefit here from some conversations on campus on your procedures to be sure that they are fair, they're equal, and that they are clear to the campus community, so there's no confusion about perceptions of inequality there.
All right, I'm going to talk a little bit about how we've integrated some of these recommendations of the Equity and Mental Health Framework into the JED Campus Program. And to be clear, we always had conversations about inclusion as part of the JED Campus Program, and there were questions related to that. But in the world of DE&I, we can always do more. We can always think more critically. We can always think about how we can be more responsive to a diverse set of students. And given that now we had two sets of disparate recommendations, how do we bring them together? And so when we think about our process for that, we did a couple of things. I think, and the first bullet here is so interesting to me, coordinating internal diversity, equity, inclusion, strategic planning within JED. So we can't go out to schools and say, you should be doing all of these things unless we turn an eye on ourselves and do them also, right? So we have to think, are our programs culturally responsive? How can they be more culturally responsive? How do we work as an organization? How are we supportive of our coworkers and colleagues that are people of color or people from marginalized identities? And to be frank, we don't have it all down yet either, right? I mean, like, that's the sort of thing. We're always working on it. We're always trying to improve. But we consider ourselves partners in that effort with our schools that we're working with. And so we also need to go through these processes of really evaluating how well we're doing within the DE&I world and continuing to make changes. We also updated JED Campus recommendations. So we really thought about, we've been talking about these specific recommendations. How can we make them more culturally inclusive? How can we provide more guidance to schools in doing these things, but in culturally inclusive ways? So in the next few slides, we'll talk about recommendations that we've altered or tweaked a little bit, as well as some completely new recommendations that kind of come directly from our work with the EMHF and the feedback we got from students and faculty and staff as part of the cohort. And of course, we're also trying to provide ongoing training and staff development for our campus advisors that work within the JED Campus Program, for our subject matter experts that visit, and for all of our staff here at JED, because again, we're always seeking to continually improve as well. So here's some things that we have always talked with schools about, but really wanted to think about how we could do it differently. So we've always, like I said, we've always talked to schools like, you should be doing programs, you should be doing activities, should be doing campaigns that are promote inclusion and diversity. And I would say most of our schools that we work with are doing those things and trying to do those things. I think the one thing we called out explicitly here is the cultural competency training and how important that is. And that for students, that could come in a number of ways. It could be part of first-year experience programs. It could be part of orientation. It could be infused within the curriculum in various subject matter areas, but really like opportunities for students to understand content through a cultural lens and have discussions with each other and dialogue about these things is incredibly important. But it's also cultural competency training in a couple other ways that we think about at JED. So when we think about gatekeeper training, for instance, we want to make sure that our gatekeeper training is also culturally responsive. So as Sophia was saying, signs of distress look different in different cultures sometimes, or sometimes people are more likely to emote when they're in distress when others may not. And so being cognizant of that, including some material and some conversation and discussion about that in gatekeeper trainings is important. And just also thinking about who is doing those trainings, who are the folks on campus that are doing those trainings, and which groups are being trained, right? So in addition to including elements of cultural competency, thinking about, are those trainings reaching all the populations you need them to reach on campus? And if not, why not? And trying to figure out a plan of action. So schools, for instance, are sometimes, if your gatekeeper trainers are folks from your counseling center, and let's say they happen to be white, partnering with someone from the multicultural support office to co-host the training, or training champions across campus through train the trainer programs that are of diverse identities may help reach those different populations in different ways, and they might feel more represented in that content. The second one is we've always talked about making sure that schools are including in institutional strategic plans that wellness and mental health is a priority, that's being messaged out regularly by campus leadership. But we also think it's important in light of the EMHF and in light of the experiences we're hearing from students to call out specifically that support needs to be for students of color and other folks with marginalized identities as well, that is a different experience for them, that they may need different support or additional support in various situations, and calling that out explicitly makes people feel heard and seen. Now, the caveat there is you got to deliver, right? You can't just say it. You've got to actually do it. So that's when we think about this comprehensive approach too. All of these steps interact with each other. So it's great to add some language into your strategic plan or onto your website, but when you talk about student retention, when you talk about student satisfaction, often that's an expectation mismatch. If they're sold an experience and then they come to campus and it's not that experience, that's not a good place to find yourself. So, I know in some ways I'm preaching to the choir here. You all know that, but really I think that drives home this idea that all of these recommendations have to be thought about in conjunction with each other. You want to be working in multiple facets of the strategic planning when you're doing this. Considering the needs of diverse students in space planning activities, we always talk about space, the importance of space for social connection, how are students using it, what students are using space. If you have commuters, do you have a space for them to hang out in between classes, or are they really just going from their car to their classroom and back? But really thinking about including students in thinking through that plan, getting the feedback of those students. Really, in any student planning, you should be including students with diverse identities, but definitely with space planning and thinking through, do you need to provide spaces for specific student groups to gather to? Because again, we really want to be fostering those opportunities to build community on campus. The next bullet is the same thing. Really, when you're creating mental health initiatives and programs, the best way to make sure that they're culturally responsive and that people feel themselves represented in it is to actually include those students in the development of those, what that messaging looks like, what that imagery looks like, what are the taglines, et cetera. If you're going to do a campaign, if you're going to do a social media campaign, really making sure you're including diverse students in those efforts. The last one is really something that we've talked about too. We really want to make sure that when we're in a very divisive time within our society. There's lots in the news. There's lots of fear. Regardless of any political views you have, everybody can agree that there's lots of dissent and lots of rhetoric that is being tossed around, and various events that people see in the media, and providing space for people to actually process those out is incredibly important. And thinking again about who are the faculty and staff that are going to help with that processing. Knowing that on many campuses, there are few numbers of faculty and staff of color that are often asked to do all things in this space, and being understanding of their needs and self-care as well. And then there were a few actions that we added in the next slide, which were completely new. We're having a little bit of a technical issue here with moving to the next slide. There you go. All right. A couple things, and they do come kind of directly from the EMHF in some ways. The first two kind of go together. You should be analyzing data by demographic group as it relates to mental health and wellness. You should be thinking about, are there big differences between different groups on campus, and if so, thinking about why that might be and how you can respond to it. And to be clear, I know not every school can afford big quantitative data surveys and things like that, but there is a lot of data that you can gather on campus. Qualitatively, there are simple things you can do on campus to gather this information, but we do want schools to be gathering that information and then really spending time analyzing that and trying to be responsive to what that analysis reveals. Directly from EMHF recommendation number 3, developing hiring practices that promote the recruitment and retention of diverse faculty and staff. Where are you hiring? How are you reducing bias within your hiring systems? Where are you posting, et cetera? And I know this is something that many schools try very hard to do, and it's also very hard to sometimes recruit diverse faculty and staff, particularly if you're on a campus that already doesn't have diverse faculty and staff. It can be harder, but I think there's other things that you can do, particularly in the short term as you work towards that. Something I like to point out here is something Sophia mentioned is really, particularly for mental health and primary care providers on campus, providing some sort of training around culturally responsive care is incredibly important. So you may not be able to hire folks that look like your student population or are representative of your student population right away. It might be something that's going to take a few years, a couple of years, maybe more, to really work towards. But in the short term, things you can do is provide that training so that the students from marginalized identities that are on campus can come and find that they have somebody that cares for them and they feel safe with that person. And that's part of the next step too, is really thinking about what are those, how can you encourage utilization of health services? Part of that is the type of care you provide. Part of that is the training of your healthcare providers. But also part of it is how are you messaging out to different students of diverse backgrounds? How are you, how are you advertising services? Where are you advertising services? When we think about international students, for instance, what terminology are we using, and how do they potentially interpret what mental health is and what wellness looks like? So really, just thinking about the language used too, and how we talk about our services and resources can be helpful in that regard. And finally, directly from the recommendations, also as Sophia mentioned, and we've added this as something that needs to be done. Really coming up with a protocol and process for responding to violations of the non-discrimination policy. And for some schools, that works like part of their BIT team or behavioral intervention team. Sometimes it can be a separate group depending upon resourcing. Sometimes it can be a subgroup. But the important thing is that it's clearly defined for students and it's accessible and people know about it and understand that that is a resource available to them.
So we want to share some highlights from some of the schools that we're working with in the cohort, the Equity and Mental Framework pilot cohort, the 17 schools. So one of them, we're very proud of, Western Michigan University, who has taken on, we highlighted the Equity and Mental Health Framework recommendations that we think they're doing really well in. For example, they definitely have a campus-wide engagement happening through their JED Campus and Equity and Mental Health Framework pilot cohort. Their student leader engagement is going really well. There's a newly formed group called Exhale. It's a student organization focused on mental health and wellness among marginalized students. So they've been partnering with them and really getting students involved. They also, Dr. Gary Bischoff, who's been our liaison to Western Michigan, was awarded an Internal Support for Faculty Scholars Award of 2000 to continue doing research and focus groups and really learn more from students of color about what their experiences are and how they can be helpful to them and supportive. They also we provided training for the faculty and staff. Through the Steve Fund, there was a webinar that was offered, and we have a picture on the next page, but it was on unconscious bias and microaggressions and ways that language can be looked at differently, and that was presented by Dr. Alfie Breland-Noble. They've also had other trainings and opportunities for discussion based on their coordination of our efforts together as part of this project. They've also been doing a lot of resource and information sharing. They partnered with Kalamazoo College right nearby to do their training, and Dr. Kelana Ferguson has been really in communication with Western Michigan, and they are also, Kalamazoo is also part of this Equity and Mental Health Framework cohort. So we're very proud of them and their coordination with each other. One that I think I skipped over the dedicated staff hired to outreach. Just sometimes we think we need to have full-time positions, but you sometimes can accomplish this by having a graduate assistant or a part-timer really focused. So that's what they did. They hired a grad assistant to help promote wellness to historically marginalized student populations on their campus. So on the next slide, we definitely congratulate them. They won the 2019 Higher Education Excellence and Diversity Award. So clearly their efforts are being recognized nationally, and we are very excited to work with them and continue to gather information so that we can move forward with what the future could look like with some of the information in the equity and mental health framework. And that's the picture I referenced before as they sit together to watch the webinar that I mentioned before. Another school that we are very excited about is the Montclair State University, who is, again, a JED campus and EMHF cohort school. They have coordinated campus-wide and created a multidisciplinary, diverse group of faculty, staff, and students who are working together to make campus environment really great for everybody. We've been working with Dr. Jun Uy, who I presented with at a conference about some of the work that they've been doing. He has been doing statewide coordination for suicide prevention, and they're having a one-day conference in June around this topic, and we are going to present there on some of the work and what they have learned from their equity and mental health framework, focus groups, and other data gathering. One thing that's interesting about Montclair State is that it's a very diverse campus. But one thing that we all learned going through this process is that even on a campus that is considered diverse, Hispanic serving institution, minority serving institution, it's still a challenge to figure out what's happening within groups and how collaboration can best happen and communication among student groups and different identities on campus. So we're very proud of the work that they've been doing, and they really have taken the time to listen to students and figure out how they can also be supportive. And here's a quote from Dr. Uy. Through the EMHF project, we were able to glean from focus groups held with both students and staff the kinds of changes we need to make in order to better support the mental health needs of our diverse student population. Overall, the EMHF project has been an incredible resource that provides structure for building sustainable mental health infrastructure for students of color. And that picture there is me and Dr. Uy at the NASPA conferences on student success last June. Finally, the third school that we want to highlight, and Dr. Kathy Zakarian is our liaison there, has been really great at coordinating an interdisciplinary team on their campus to think about this data and considering ways to improve the campus environment for students of color. They have done some training. They have really benefited from the student focus groups and done additional work trying to involve students in this work. They've developed partnerships and have been using the Set2Go resources to help with transitions as students are coming in. They also created community peer educators. So as you can see, this is another school that has really taken on the responsibility for creating an improved campus environment for all students, but definitely for students of color. And the next slide. Here's a quote from their Vice President for Student Affairs, Elliot Strickland. The JED Campus Comprehensive Approach provided us with an incredibly valuable framework which guided our daily work. Our process, which was led by Dr. Kathy Zakarian, Director of Counseling Services, has resulted in profound changes on our campus and in our approach to student well-being. Our campus is a safer and more supportive environment thanks to our partnership with JED and the commitment and hard work of our outstanding faculty and staff. So as you can see, we're very proud of our cohort schools, our JED campus schools, and we know that this work is going to and has been creating much better and supportive environments. And the bottom line for us is preventing suicide for all students and specifically students of color on these campuses.
Wonderful. So with that, we've come to the end of our slides, and we're going to open up to questions from our audience. So as a reminder, you can submit questions on your GoToWebinar dashboard, which we will view and speak out loud for the rest of the audience. And to start, we're going to hear this question about specific populations. And so Sophia, are there statistics that the JED Foundation has completed related to American Indian and Indigenous students at colleges and universities? Perhaps another way to ask this question is, in what ways is JED stratifying students of color into the different identities and providing specific support to those populations?
We haven't analyzed data separated out for Native American and Indigenous populations, but we know that, for example, the 1,000 students that we had that survey a couple of years ago, it was such a small number that it was not statistically significant in terms of singling out information for Indigenous populations, and it was very similar too for Asian American populations. So where we can look for data and analyze is through our Healthy Mind Survey information. They have on their website a way to stratify some of their data around mental health behaviors, beliefs, attitudes. So that's something we can do if people are interested in looking at data that way. We're moving towards trying to put out more and more information from HMS since it already exists and it's a really rich set of data. So we'll look into it and see, and hopefully there is enough of a student population response in those surveys for us to be able to analyze that data and look at it. So I'll make a note of that, and we will put information out if we're able to find it and have it validated.
And I'll just add that I think we were close to potentially working with some tribal colleges and universities about a year ago, and unfortunately it fell through. And for me, that was disappointing. I know one of the things was that what I heard from the tribal colleges was that they weren't necessarily very open to having outsiders come in and talk to them about how things should be done. But I would love that opportunity to work with a tribal college, because I also think that would be an incredibly rich learning experience for us at JED to really understand the experience of Native American students and ways in which we could better support them. And again, think about culturally responsive ways to do that.
Thank you. So what is the process for partnering to work in the JED Campus Program or an EMHF cohort? Does it operate as these specific cohorts, or do they start at any time?
JED Campus starts twice a year, February 1st and August 1st. You could write to me, Lee. My email address is up there on the screen. The EMHF cohort is a grant-funded opportunity. It's in process, and it's a learning experience for us to really understand how best to implement the EMHF on campus. There won't be future cohorts of that because this whole integration has really helped us take those learnings and apply them to the general JED Campus program. But that being said, Sophia, you can talk about, she does lots of other trainings and other interventions and things like that we could provide.
Yes, once some campuses have downloaded the Equity and Mental Health Framework, they've reached out to us, they've reached out to the Seed Fund, so we're always open to create opportunities for your faculty and staff to really engage. So for example, I was at a campus on Monday, we spent the day just talking about what parts of the Equity and Mental Health Framework were relevant to them and how they can better serve students and really be mindful of not only addressing mental health in general for students, but what happens with students of color and other marginalized student identities on campus and how they can use their language and their, opportunities for engagement to really learn from each other. So that's not a formal process per se, but what I'm hoping is that when we do complete the work with our Equity and Mental Health Framework cohort, we may have ideas for further engagement and training and workshops that we can provide to campuses who are really needing more information, and that we say you should do culturally responsive training, but I think sometimes the idea is, so where do you get that training? So that's something that I'm also going to be working on as with my work at JED, to identify experts in the field, subject matter experts who are in the counseling, psychology, and other helping professions who can really use some of their research to share some interventions and strategies. So we're watch out for that. We're still working on it, but I'm hoping that we can connect with many scholars out there who have information that we can share.
Thank you. So does the EMHF the Equity and Mental Health Framework provides specific recommendations to campus public safety training to inform their interactions with students of color, given traumatic current events involving police and gun violence.
What I would say there is that any part of this work where we're saying, you know, it's important that you have systems in place where students can report. It's important for your staff to be trained to respond to crisis situations. This is completely related, and we don't have specific training that we offer to public safety, but I think the same information that we would share with faculty and staff about being open, being responsive, and really thinking about how crisis shows up for different populations would be relevant to public safety. So right now we don't have a specific training, but I know that the Steve Fund has done some work with some campuses. I'm not sure if it was isolated to public safety, but we can definitely help if that's something that you're looking for. You know, we're always open to discuss what your needs are and what specific information for training and tools you need.
And we have time for one final question. So on small campuses in which the majority of health and wellness staff are white, could you please reiterate the recommendations for addressing this reality, given that students of color may be more apprehensive to utilize the services?
Well, what I always say is everyone should be able to help every student. Sometimes I find that some campuses will say, well, we'll send all students of color to the one or two or few staff members because they might be able to understand what their needs are. But I would say to a school where you're not able to at this time have faculty or staff of color that you're going to add right away, be open, listen, and also meet students where they are. Sometimes our approaches are to have students, oh, just come to me, as if that's just so easy. Some people are not going to just come to you. So it's important to get to know students and don't wait until there's a crisis or there's a contentious situation. Build relationships with students early on, and you do that by supporting events, by getting to know campus club leaders, going to student government meetings and introducing yourself and really letting them know I'm not just saying I'm here for you. I am physically here for you by coming to your stuff. So that's the best I can say, that, you know, if you're not there often and your presence is not felt by them, no students are going to come to you, but definitely students of color will not likely connect with staff members who have not shown any interest in them otherwise. So I think it's a two-way connection there.
Thanks, Sophia. And so with that, we've come to the end of our webinar, and we are so thankful to Lee and Sophia for guiding us through this presentation and this discussion. And we thank all of you on the phone and online who joined us today. We will have an ongoing slate of webinars throughout 2020 where we will continue to look at different strategies and different efforts to support students of color and all students on colleges and universities to support mental health and prevent suicide. And so we look forward to you joining us then, and we hope that you all have a great rest of your Wednesday. Take care and have a good day.
Thank you.